Good afternoon. This is the 2-minute warning. Please press 1 to ask a question.
Good afternoon, everyone, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have 195,549 lab-confirmed cases, 1,168 new cases reported since yesterday, 905 people in the hospital, and sadly, 3,286 people who have died. We remember all those we've lost to this cruel disease as we keep their loved ones in our thoughts right now. I'm pleased to report that North Carolina continues to remain stable in our key metrics. We want the level of cases to be even lower, which is why safety measures like a mask requirement and social distancing are more important than ever. When we ease restrictions, that means our efforts are working. And to ease them more or prevent us from having to go backward, we need to double down. It means we have to be committed more than ever to what works: wearing a mask, washing our hands, waiting 6 feet apart from others. At the end of next week, the current executive order is set to expire on October the 2nd. Today we are announcing that because of our continued stability, we plan to take another step toward Phase 3 in the coming days if our progress holds. That step will mean larger outdoor event venues will be able to open at 7% capacity starting next Friday, October the 2nd. We share this news today so those outdoor venues with seating capacity of more than 10,000 can begin preparations that are key to safely reopening their doors to have a limited amount of socially distanced fans. We'll continue analyzing our data and indicators as we determine how to move forward safely in other areas that may be included in the new order on October the 2nd. In it, we hope to ease some other restrictions while keeping in place safety protocols like masks and social distancing. As COVID-19 has struck our country and the entire world, we know that many small businesses have faced unprecedented hard times. Most of them want to do right by their employees and their customers, and that has forced tough choices. Today, we offer more help. I'm pleased to announce that my administration will stand up the North Carolina Mortgage, Utility, and Rent Relief Program that will direct $40 million to small businesses. This program will use Federal CARES Act funding to cover rent, mortgage, and utility costs for qualifying businesses. This initiative will offer help to small businesses that lost revenue between April and July because of COVID-19. This assistance will be one of several state and federal efforts that aim to keep people in their homes, on their jobs, as we fight this pandemic's monetary effect on our state. Small businesses are the backbone of our economy, powering our local communities and giving back in so many ways. They deserve our support, and this new initiative can help them weather this tough time. But substantially more help is needed for small businesses, and Congress and the President must act as soon as possible. And I want to take a moment to recognize another group of hardworking people whose dedication to our state is helping us through this pandemic. Our North Carolina National Guard has stepped up once again to support our food banks. Due to continued shortages of volunteers along with record demand for food at our food banks, I've directed the mobilization of 125 North Carolina National Guard soldiers to support at least 10 food banks across our state. I have visited 2 of our food banks in the last few weeks, and they raved about how important the work of these soldiers has been. The need is clear and overwhelming, and that's why I've ordered their activation again. Already, the Guard's food bank operations distributed 5.6 million meals and 322,000 school lunch meals from the pandemic's start in March until last month. It is critical that we keep food banks up and running, getting meals to those who need them. And we're grateful that the Guard members are ready to help our communities and our state. And I'm thankful for all North Carolinians that they're doing their part to prevent the spread of COVID-19. You're going to hear from Secretary Cohen today about another way you can help with our new exposure notification app, Slow COVID NC. This new app gives us another tool to slow the spread of the virus. We have seen our strength and team spirit on full display these last 6 months. If we keep up our commitment, we can drive our numbers down even more and put our state in position to come out of this pandemic even stronger. Along with Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, we have the Department of Commerce's Senior Assistant Secretary, David Spratley, and Emergency Management Director, Mike Sprayberry. Cameron Larson and Monica McGee are our sign language interpreters, and Jackie and Jasmine Mativier are our Spanish language interpreters. So I'm now going to recognize Dr. Cohen. Dr. Cohen?
Well, thank you, Governor. Since the beginning of this pandemic, our local health departments have been working hard to quickly identify and research people who may have been exposed to COVID-19 in order to get them the support and the resources they need to protect themselves and their loved ones. Today, I'm excited to announce a new tool to support that work and help people know as quickly as possible if they've been exposed to COVID-19. Our new Slow COVID NC app is now available to all North Carolinians as a free download for mobile devices in Google Play or Apple App Stores. The Slow COVID NC app uses Bluetooth technology to let users know if they may have been exposed to someone with COVID-19, helping them to act quickly to protect themselves, their family, and their community. Before I explain how it works, I want to be clear about what it does not do. First, it does not collect, use, or share any personal information. It does not use GPS or know your location. It does not know where you are. It does use Bluetooth, which is like radio waves, and only knows if your phone has come into close range of another phone that also has the Slow COVID NC app. It uses an anonymous string of characters that change every 10 to 20 minutes to represent your phone. They are never linked to your identity or location, only to the date and the time. So what does Slow COVID NC do to make sure that you can know very quickly if you've been exposed to COVID-19, which is going to help us slow the spread of this virus? Here's how it works. If someone tests positive for COVID-19, they can get a unique, randomly generated PIN to submit into the app. The voluntary and anonymous reporting system will then notify phones with the app that were in close contact to your phone that they may have been exposed in the last 14 days. That allows users to quickly act to protect themselves and their loved ones and their communities. And if you need to isolate or quarantine, the app can connect you with guidance on checking symptoms and getting support. Downloading the Slow COVID NC app is easy and free. I downloaded it to my phone last night. It's available in English and Spanish. It lets you play an important part in protecting your friends, loved ones, coworkers, and community. As we move around more, Slow COVID NC is a powerful tool to help us slow the spread in North Carolina. And the more people who use it, the better it works. So go right now, take out your phone, go to the App Store, and search for Slow COVID NC and download it right now for free. There's also another powerful tool to stay healthy, and that's a flu shot. The flu vaccine is the single best way to prevent the flu and its complication. It lowers your likelihood of getting sick, and if you do catch the flu, it's likely to be milder than if you weren't vaccinated at all. Each year, scientists and health experts develop seasonal flu shots to protect against 3 or 4 strains that research suggests will be the most common during this upcoming flu season. The vaccine works by triggering your body to produce protective antibodies that help prevent the flu. Now is the time to make a plan for you and your family to get your flu vaccine, which also helps us in our fight against COVID-19. Contact your healthcare provider today or visit vaccinefinder.org to find a convenient location near you. So get your flu shot, download Slow COVID NC app, help us keep North Carolina as healthy as possible. As always, practice the 3 W's, wearing your face covering over your nose and mouth, waiting 6 feet apart, and washing your hands often. Wear, wait, and wash, and whatever your reason, get behind the mask. Thanks, Governor.
Thank you, Dr. Cohen. We'll now take questions from the media. If you can identify yourself and your organization, please, and we'll take the first question.
Our first question comes from Rebecca Martinez with WUNC.
Hello, Governor. This is Rebecca Martinez from WUNC. I appreciate the time to ask a question. I understand that the Andrea Harris Racial Equity Task Force to improve, reduce racial disparities of people impacted by COVID-19. It was released today, and I'm just wondering or Dr. Cohen can speak to the major findings and how they plan to make improvements based on their recommendations.
So this task force has a group of people that I've appointed from all over North Carolina to analyze the racial disparities that we know are there in our healthcare system, education, economic system, and environmental justice. They've begun meeting, going over data, and they're planning to make some recommendations for our administration and likely for the state legislature as well to help us attack this. This pandemic is shining a light on these inequities that we know have always been there, but we've seen COVID hit our communities of color harder, and this should provide us information that we need to make those important decisions. I don't believe that there has been any report. I know they have had several meetings, and I've gotten some updates on those meetings. I don't know if there was a particular issue that you wanted to bring up. And Dr. Cohen, do you have anything that? So if you wanted to ask a follow-up question about any particular issue, but they're working, and we look forward to their finished product.
Follow-up from Rebecca Martinez, WUNC.
Thank you very much. I'm sorry about that. So, today they were discussing options around access to health care, economic opportunity, and business development, et cetera. I guess I understand that they're speaking a lot about topics that are important, and I'm just wondering if there's been I guess, do they have clout to decide how their goals will be met when they're available?
Well, they will make recommendations at the end of the day. And we hope that one of the reasons I appointed this strong task force, not only did I want them to make recommendations, I wanted them to help implement them. And some of the recommendations may be able to be done administratively. Some may be able to adopt some safeguards or regulations that would help. Some recommendations may need specific legislation in front of the General Assembly. We'll take all of that when it comes from their report, and we obviously do not want this to be a report that stays up on the shelf. We want it to be active. We want to be engaged in these issues, and we look forward to trying to implement the recommendations when we have them from this task force. Next question, please.
Our next question is from Michael Perchik, WTVD.
Good afternoon, Governor. This is Michael Perchik with ABC 11 in Raleigh. Thank you for your time. It's a two-parter. At this point, do state health officials see any outbreaks related to gyms reopening, museums, aquariums, or playgrounds reopening? And based off that data, what does that lead you to believe moving forward for the potential reopening of bars, nightclubs, and movie theaters?
All of these specific places and events have different levels of risk, and the health experts have made recommendations based on the various levels of risk. And the people of North Carolina, most of them have been working really hard to get our numbers stabilized. The more that happens, the more we can ease restrictions and the more that we can do. And I'll let Dr. Cohen address that specifically. Dr. Cohen?
Thanks, Governor. Yes, as we look at our metrics, and you can always follow along with us on our dashboard that is updated every single day, we look at those same 4 key metrics. We look at our surveillance data, which continues to decline across the state, which is good news. We see our cases are holding steady. Of course, we'd like to see those decline even further. We still see a high level of viral spread. The White House Task Force indicates that we are orange on a green, yellow, orange, red scale. So we're not red, which is good. We're getting better to orange, but we want to be heading towards that green area. In terms of our hospitalizations, we continue to decline, and our percent of tests that are positive also has been improving as we have seen us at around 5% over the last number of days. So overall, we see some stability, some improvements, and again, as the governor said, that's a lot of hard work. But I think what we know is this is not a final destination. We have to keep working to keep that stability and to further make progress. And so I encourage everyone to do those 3 W's, to make sure that you are wearing a mask, to keep social distance, and then we'll be able to continue to make progress as we go forward. Thanks.
Follow-up from Michael Perchik, WTVD.
Hi, just to clarify, at this point, have health officials been notified of any specific outbreak tied to the reopening of gyms, museums, aquariums, or playgrounds?
Hi, Michael. So, right, we are still in that period. We were looking at our metrics to understand, did those easing of restrictions, which just happened about 3 weeks ago, is that starting to show up in any of our metrics? So we still have some time here to look at our numbers and our trends, which is why we are continuing to evaluate those. We haven't heard of a specific outbreak yet in any one of our of those scenarios, but again, it's still pretty early. Thanks.
Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn, the News and Observer. Thanks for taking my questions. About the viral spread and being orange, do you have any data for the state if there's evidence of spreads at outdoor events or indoor events that are past that, I guess, more than a few weeks ago, whether that's through contact tracing or anything else? And then to clarify on the outdoor venue capacity, that it's only 10,000 or more, and why is it that number specifically?
So on the outdoor events, we wanted to make sure that We're talking about large outdoor arenas where there would be plenty of space for social distancing, and looking at sizes of stadiums across the state, the 10,000 number was determined to be a good number. The 7% capacity leaves plenty of room for social distancing, but not just that. We think it's really important for these arenas to have separate entrances, to not have places where people can congregate, to make sure that only families or people who live in the same household sit together, and that there is significant social distancing and mask wearing. And I know that the Department of Health and Human Services has had numerous conversations with colleges, with professional sports teams and others who would be wanting to open their doors to have 7% of capacity of fans in the coming weeks. We do believe that outdoor events are safer than indoor events, and therefore that's why we're concentrating in that lane. As to any of the outdoor events that have been held and whether there's anything specifically with those, I'll let Dr. Cohen address that.
Thanks. As we look at our trends across the state, obviously we've held mass gatherings to be at a low level. So we haven't been seeing those large gatherings, which is a good thing. I think that has been protective for our state. We are seeing our level of virus spread be lower. We still have a lot of work to do. I would say when I look across our state, the particular parts of our state that we are looking at and paying attention to are the northeast parts of North Carolina, as well as now the Sandhills region and a couple of the counties on the South Carolina border. And what we're noticing is that it isn't necessarily any one thing that is driving the infections. Sometimes it can be related to a religious gathering or a family event or spread within your own household. So I think it's really important for us all to remember about wearing masks when you're with anyone who is outside of your family unit and you share a roof with. Even if it's your extended family, even it's when you're at church, we want to make sure that folks are wearing a mask and staying social distancing in all of those settings. We know that any time that you can be close together, particularly if you're indoors, those can be higher risk settings. So we encourage everyone to take the precautions that we've been talking about over and over. And I'd encourage you to download the Slow COVID NC app, because if you are in a setting like a larger venue, it is really hard to do contact tracing. We don't necessarily know who's been next to who, but this app could be very helpful. So download the Slow COVID NC app for free right now as another tool to help us slow the spread. Thanks.
Next question, please.
Follow-up from Dawn Vaughn, News and Observer.
Hi, thanks for taking the follow-up. With the venues, could large outdoor venues like Dick's Park or other places where there have been festivals that don't have actual structured seating be included? And then for the new app, is there a certain number of people that's needed for a critical mass for it to work well?
These would be outdoor seated arenas that would be included in what we're talking about. The parks are open for people, but they are still subject to mass gatherings within the parks. We still want people to keep wearing masks and stay social distance, but we certainly don't want more than 50 people outdoors gathering together. So within the parks, people are still subject to the mass gathering limits. And I'm going to let Dr. Cohen answer the app question.
Thanks, Dawn. As far as the app, I think the more folks who can download it, the better, right? If more folks have the app, it means it's going to be able to signal to you if you've had an exposure. So the more people, the better. We've actually been targeting at first and working very closely with our universities and our colleges, where we know that folks are living closer together in dorm-like settings or in apartments. And so I think those are the places where we know we can probably get a good amount of folks to download download this. And I want to thank partners across the state and many, many universities who've been working with us very closely to encourage students at their universities and college to download this. But we want this to be for all North Carolinians. So we really want you to go to your phone right now, go to the App Store, very easy, free, download Slow COVID NC. You don't put any personal information into that, and it sits on your phone. It's just another tool to protect you. Thanks.
Next question, please.
Our next question is from Sharon Van Zwieten with Spectrum.
Thank you for taking my question. This is Sharon Van Zwieten from Spectrum News 1. This is for Dr. Cohen. There's been a lot going on at the CDC this week with them putting up and then taking down information about the aerosol and the virus being in the air. What is your take on that?
Hi, Sharon. Thanks for the question. I think we've talked about how this virus spreads. And remember, it spreads from particles that come from your mouth or your nose and then obviously move through the air and then could land on other surfaces or people. And I think we're debating some semantics here of air. We know the particles travel through the air. The question is, how long did they go in the air? I think the important thing for us all to focus on is we know what works to prevent the spread. And that's this. The CDC director said it last week in his congressional testimony. We know masks work. We know it prevents those virus particles that come out of your mouth and nose from spreading. It's why it's important to put your mask over your mouth and your nose. So I don't think we should get caught up in the semantics of how long does something hang in the air. Use this mask, protect yourself, protect your family, protect your community. Thanks.
Next question, please.
Follow-up from Sharon Van Zwieten, Spectrum News.
Yes, this is for Governor Cooper. Thank you, Governor. My question to you is, what special provisions are you directing to the Board of Elections for safe distancing for the election day? And are you encouraging people to vote by absentee ballot or by mail-in voting?
The State Board of Elections and the Executive Director have taken a lot of steps to make sure that voting is safe. I know that they have worked with the Department of Health and Human Services to provide those guidelines. I know that Emergency Management has provided personal protective equipment to our state boards of elections so that we can make sure that people can exercise their constitutional right and do it safely. You know, I would encourage people to do one of two things. Number one, to vote early in person, which you can do beginning October the 15th, and you can go to your County Board of Elections website to find out where you can go to vote early in person beginning October 15th. Or to vote, if you don't feel comfortable going in person, vote no excuse absentee by mail. And you can go online to the State Board of Elections website and request an absentee ballot, and it will come to you, and you can fill it out and have it witnessed and mail it back in or bring it in. And you can go online and track what happens to your ballot to make sure that it gets accepted. So I think the board has done a good job. I think both of those ways are safe ways and secure ways for people to cast their ballot. I didn't mention Election Day, but if you haven't done either one of those by Election Day, please make sure you go in person and vote on Election Day. I think the idea is to try to reduce the number of lines and to try to make sure that this is as safe as possible. But I feel good about where they are and things that they've done. Next question, please.
Our next question is from Richard Craver, Winston-Salem Journal.
Hello, Governor. This is Richard Craver with the Winston-Salem Journal. I was just wanting to make sure on a couple of things. One, what was the reasoning about the timing of the issue with the outdoor facilities? Is this sort of a follow-through on the complaints that you heard from the parents of the collegiate football players at State and Carolina and the like? And then at the same time, is there any other type of indoor-outdoor venue that you would consider before October 2nd?
So as part of Phase 3, the Department of Health and Human Services has looked at and continued to look at the potential of allowing large outdoor arenas to have more fans than the mass gathering limit would provide. And I think what they've decided is, because our numbers have continued to be stable over a period of time, that they have felt more comfortable particularly if these arenas have a good safety plan, that they can let a small number of fans into the stadium. We will be announcing next week about what is going to happen with the order that ends on October the 2nd. We hope and believe that this large event venue issue will be in that particular executive order. The reason we chose to announce that today is because we've heard from these venues that they need time to print tickets, to tell their fans the procedures of all that has to go on in order to make sure that everybody is safe. So we told them that if we continue to see stable numbers, that it is likely, very likely, that you will be in this order that would begin on October the 2nd, the new order, and that you would be allowed 7% of occupancy for any arena that's over 10,000. There may be other issues that will be addressed in the next order. We hope that that will be the case, and we're continuing to analyze the data and are making decisions about that, and I would expect an announcement on that sometime the first of next week. Got anything you want to add to that, Dr. Cohen? Okay. Next question, please.
Our next question is from Rose Hoban, North Carolina Health News.
Hi, Governor, Secretary Cohen. Thank you for taking our question. This morning or yesterday, the Inspector General at the Centers for Medicare and Medicaid Services released a report noting that North Carolina has been lax in its oversight of nursing homes related to safety and emergency preparedness. They found a number of instances of noncompliance with safety requirements, et cetera. You know, given that we've had a high death toll from COVID in the state's nursing homes, what's the plan about better enforcement of safety regulations in these facilities?
First, one of the hardest things about this pandemic has been the loss of life in our nursing homes. And I know that all of us take that seriously. It's one of the reasons why our administration has provided testing, personal protective equipment, making sure that nursing home facilities are inspected. And the efforts that our administration has taken has even been cited as a national model in some instances. But we know that with congregate living, that virus can more easily spread. And this administration is working hard to prevent that and working hard to save lives, and we consider it a priority. But I'm going to let Dr. Cohen specifically address that as well.
Thanks, Rose. As we've talked about before, in terms of our oversight of nursing homes, we do have a part of our department that goes in and surveys to understand if nursing homes are doing what the rules have laid out. And in terms of infection control related to COVID, we completed surveys of all of our nursing homes actually a month ahead of schedule and continue to survey nursing homes to make sure that inspections are going well there, to make sure that they are following the protocols that are needed to protect both the patients who are there as well as the staff. Thanks.
Next question, please.
Follow up from Rose Hoban, North Carolina Health News.
Can you be more specific, Dr. Cohen, on some of the things that you folks are doing and also some of the things that you've found? Like, what are some of the problems that have needed to be mitigated that, you've been pushing nursing homes on?
Thanks, Rose, for that. I'd have to go back to the team to have them follow up with you on the specifics of what we found. I know that there have not been any citations that have required us to do an injunction of any of the nursing homes, but certainly I know we've had citations where we asked them to improve their infection control protocols, but we'd be happy to go back and do that. As you know, that's publicly posted. Thank you.
Next question, please.
Our final question is from Brian Anderson with the Associated Press.
Hi, Governor. Hi, Dr. Cohen. Thank you so much for taking the time. Good to talk to you both. Governor Cooper, Senate candidate Cal Cunningham recently said he'd be, quote, hesitant to take a coronavirus vaccine due to what he feels was a rushed process under the Trump administration. Do you share that skepticism? And secondly, we know that of the 4,000 college students that have tested positive, Dr. Cohen's department told us last week that only one individual was admitted to a hospital. And we also know that there's very minimal cases in these school settings with just 50 cases, 9 clusters, and no deaths. What science can you say that says it is okay for 5th graders to come back for daily in-person classes, but not 6th graders?
Well, first, I would take a vaccine for COVID if it is approved by the FDA, but whenever it's my turn, I know that we're going to be coming forward with a vaccine plan, and the frontline healthcare workers and seniors and others will be part of that plan. But I think that there are a lot of eyes that are going to be on the data that comes about from testing vaccines. And I've talked to Dr. Cohen about it. She's talked to people all over the country. Obviously, there's a lot of desire for a vaccine, and but also a lot of desire to make sure that that vaccine will be effective and safe. So yes, I think it's going to be important. And one of the things that's going to come out of all of this is we got to make sure that we continue our efforts getting people vaccinated, not only for COVID-19 when it comes, but all other diseases that are out there. We particularly with our children not in school, many of them have not gotten vaccines that they need. And we need to make a real push in order to make sure that we're protecting people's health. And I'm going to let Dr. Cohen address the issue regarding children at school.
Hi, Brian. As we talked about last week, when we talked about K through 5 and allowing K through 5 to be able to move forward with a plan B, meaning that you can have slightly more kids in the classroom. The reason we made that differentiation was based on a number of studies that we've been looking at. Some are international, some are here in the United States. The biggest study was done in South Korea that looked at different ways in which virus spread amongst what it seemed to be like kids under the age of 10, which corresponds to 5th grade, and then children 10 to 18. And it does seem that kids who are over the age of 10 seem to spread the virus more similarly to adults, whereas younger kids seem to spread the virus less often. They get it less often, they get less sick, and they spread it to others less often. Doesn't mean not at all. And we say that because it's really important that we have safety protocols in place in no matter what plan a school is choosing. I think it's really important as we think about school reopenings that it's not just about the metrics, it is about those safety protocols. And no matter whether you're choosing plan A or plan B, that there are extensive safety protocols that take time and work to implement and are very important, and I think protect both our students and our teachers. And I think the fact that we have been as successful here in North Carolina of having low numbers of clusters is because we've had those safety protocols in place. And so I do think there is a differentiation between students who are under the age of 10 or up to grade 5 and above. Again, we're still learning from this. The data will evolve, as will our recommendations. And so we are making the best recommendations we can at this moment. I think the other piece I want to point out is also about the benefits. We talk about the risks a lot, but remember, as we think about the benefits of in-person instruction, we also have a lot of data to show that in-person instruction has a lot of benefits, particularly for our elementary school children, which makes sense. They're not quite as savvy with technology. I'll say my first grader is an okay reader, but not a great reader yet. She's still learning to read instead of reading to learn. And so, right, we need more of that in-person instruction for our younger students. Again, as we make each of these decisions, balancing risks and benefits. Thanks.
I think we have a follow-up. Next question.
Yes. Follow-up from Brian Anderson with the Associated Press.
Yes, thank you. As I'm sure the two of you can attest to personally, the nose swab test can be a bit uncomfortable, and we've seen increased interest in the saliva test. I'm just curious if either of you can explain who can get a saliva test, a spit test, and how many are available. And just to clarify on the announcement on outdoor stadiums, are you saying that this isn't an announcement going into effect? This is just a release for the planning purposes as you're still waiting on the next couple of days for the trends?
That's right. We plan for this change to be included in the order that would take effect October the 2nd. So we're not talking about any changes until October the 2nd, and also with the caveat that our numbers continue to look good until that time. So I'll let Dr. Cohen address the other issue.
Hi, Brian. Thanks for asking about saliva tests. Yes, there are a number of labs across North Carolina who are looking at saliva tests. It tends to use the same platforms that the nasal swab or the nasopharyngeal swab uses. So often they'll have to take some of their machinery out of use in order to move over to the saliva test. I know a number of our hospital systems and other labs have been in Carolina, and there's more coming onto the market every day, and we're working with the federal government on some more of the rapid test availability. So we're still waiting on some more information from the federal government on that. But again, new things coming out in the testing space all the time. We incorporate that into our work to make sure that folks in North Carolina have a diversity of testing options available to folks. Thanks.
Thank you for being with us today, everybody. Remember the 3 W's. Stay safe out there. Thank you.